Welcome to Facts TV News, where everything is true. Ministry of Health and Wellness, COVID conversations, Omicron and fourth wave.
Around this COVID-19 response, and also, as we had said earlier, the need for us to prepare for the possibility, or should I say the eventuality, of a fourth wave. We have been advised through the United Kingdom's international health regulation system that a traveler from Jamaica has returned a positive test result for COVID-19, and the genomic sequences has confirmed the Omicron as the variant for this particular result. So this is a traveler who came here on a short stay in one of our resort facilities and went back and was confirmed for COVID and confirmed for the Omicron variant. There are several conclusions that can be drawn from this, to include the fact that persons may have been infected by others within the population, or this particular individual could have interacted sufficiently while here to infect or contaminate others. In other words, I think it is best from a planning, from a precautionary perspective, to conclude that Omicron is here within our population. The conclusion is not to raise unnecessary alarm, but it is to place us on our guard as citizens, as Jamaicans, as we move about, particularly in this season of increased or heightened activity. We did say in the past, certainly at the last COVID conversation, that we do expect that the variant strain will be here very soon, given the openness of our borders, the travel to and from destinations where the variant has become the dominant strain in the population. And so it should not be surprising that we have discovered at least one case, and I do believe there are other cases. It is, however, necessary, we believe, to communicate once we have that information, hence the need to have this conversation today. Of the more, additionally, it is worth noting, I should say, that of the more than 1,100 tests that have been done in the last 36 hours by private facilities, we have, and unusually so, recorded a 7% positivity rate from those tests, and these are PCR tests. So these are the most accurate tests that are done currently using the technology. These tests were largely done on persons who were short-term travelers to the country and require by those countries a PCR test to return to those countries. You may recall that since the new variant strain, a number of countries, Canada, the UK, for example, have required a PCR test for persons coming into that country. That test is the most accurate, and what we are seeing is that we're picking up quite a lot more positives. So of the 76 positives of that 1,100 that were identified, these 76 represents, as said earlier, one of the largest reporting of imported cases in the country since the start of the pandemic. Omicron, as we understand it, is spread more easily than the original SARS-CoV-2 virus. I think the evidence is clear on that, the science, which evolves, but I think that's a conclusion we can all draw. And anyone with Omicron infection can spread the virus by an infection rate of some 2.5, so it's highly contagious. And the current vaccines that are expected to protect against severe illness, hospitalization, and death due to the infection with the Omicron variant. So vaccines still remain an important response. The conclusion again here is that there is sufficient indicators to confirm that we have to be particularly careful about the possibility of this highly contagious variant strain of the COVID-19 virus being in the population and once here moving from one person to the next. Again, it justifies the protocols that we have announced earlier. Our vaccination numbers, of course, which are the most effective response, remains relatively low. We have given 1.194 million vaccine doses, 557,000 persons fully vaccinated, representing 20.4% of the population. 25.9, just under 26% of persons have had at least one dose. For booster shots, 2,631 booster shots and 612 extended primary series or third dose have been administered since the announcement of boosters or third dose. So there you have it. There are signs that we have to confront what we had forecasted, projected, and I'm going to now ask our lead epidemiologist, Dr. Webster Carr, to present in more details around this particular variant strain and hopefully allow you, the populace, to draw some conclusions from this. Thank you. Dr. Webster Carr.
Thank you, Minister. Good morning, everyone. So today we'll look at the situation we have today. We identified 99 new cases yesterday, and this carried a total number up to 92,226 cases, of which there are 2,450 deaths with a case fatality rate of 2.6%. The daily positivity yesterday was 6.8% and the 7-day average at 4.4%. When we review the parish data, in the last 2 weeks, Portland there were 425 cases totally, and these are local cases with the parishes with high number of cases per population was St. Anne and St. James. This is a community map up to December 19, when almost 22% of our communities had cases in the last 2 weeks. It's important to note that imported cases are not included in this map. So let us move on to Omicron. Omicron was designated a variant of concern by the WHO on the 26th of November this year. Omicron is highly divergent from what is already circulating, the original and the other variants of concern. There are some changes in the genes of the Omicron variant that is associated with possibly higher transmissibility and ability to escape the immune response of the body. As of December 16th, and I'm sure this probably has changed, 89 countries across all 6 WHO regions have reported Omicron. So there are 4 questions that we need to answer to assess the overall threat of Omicron to our country and globally. How transmissible the variant is, how well vaccines and prior infection protect against infection, transmission, clinical presentation, and death, how virulent the variant is compared to the other variants, and how populations understand these dynamics, how we perceive our risk, and how well we follow our control measures, whether it be public health measures or social measures. So the first question, let us look at it. There is, at this time, consistent evidence that Omicron has a substantial growth advantage over Delta. It is spreading significantly faster with documented community transmission of 1.5 days to 3 days. So it's really spreading quite quickly. And the next question, so let us look at some of the countries in our next slide. For example, United Kingdom, France, Trinidad and Tobago, US, Canada, and we have Jamaica in there. And if we have a closer look in the next slide over the last few weeks, we note, we can see it a little better. So we'll soon get it. So we'll see it a little better. Let us go back a little bit more. I don't know. You seem to be out of sequence. Yeah. Okay, good. So we are back on track now. So we're having a closer look at the countries and the increases that have been seen since Omicron has been identified in many of the countries. So the second question, how well vaccines and prior infection protect? Really need more data, but what is available, and the numbers are small, is that there seems to be some reduction in the effectiveness related to the vaccines. That means it still protects, but the effectiveness is lower. And boosters actually increase your protection from the Omicron variant. The next question, how virulent is it? It's still too limited to be to make a definitive statement on the clinical severity related to Omicron. Hospitalization, we note, in the UK and South Africa continue to rise, and given the rapidly increasing counts. We have heard it said that Omicron presents milder, but we just don't have enough evidence to support this. But from the increases in hospitalization that we have seen, we can say that whether it's the increased absolute numbers because of the increased transmissibility and hence increased hospitalization, even if it's at a smaller proportion that gets severe, the fact is it increases hospitalization. And this is a look at what's happening in some of the countries around the world, including the UK, South Africa, and the United States. So the Jamaican situation, and really how in Jamaica we understand these dynamics, how we perceive our risk, and how well we follow control measures, including the public health and social measures. So if we look at COVID-related deaths, 95% of deaths have one or more comorbidity or risk factor. As age increases, the case fatality rate increases significantly. So for somebody over 90, 1 in 5 of them will die after getting COVID. That is significant. If for the persons in their 70, 1 in 6. And so it is very, very concerning. Males are significantly more likely to die from COVID-19 if they contract it. And so let us look at, this is a 2020 knowledge attitude survey. 70% of us don't perceive that we are at risk of catching COVID. A third of us practice physical distancing, and 1 in 5 of us comply with curfew and other orders. 1 in 5 of us wear masks when going out. So if we look at the vaccination, 1 in 5 of us are vaccinated against COVID. Is it the same 1 in 5? So the parishes, KSA and St. James have the highest coverage, but still not good enough. We need to be in our 90s really to have very good protection. So let us look at the age, because remember, age is a priority. On the next slide, the highest coverage is persons in their 70s, but that's still too low. We want everybody in their 70s or 60s or 80s or to be fully vaccinated. And we are not even halfway there yet. So that is low. The males overall are less vaccinated than females. Remember the risk of death and severe disease greater in males than females, but the males are less vaccinated. Must congratulate the males over 70 who have surpassed the females in the same age group. So getting down to the numbers, so over the last few days and weeks, the number of cases have been decreasing and probably leveling off a little bit, and the number of admissions for COVID has been decreasing and probably leveling off a little bit as well. So if we look at this data and see what could happen given the possibility of Omicron. So we use the estimated reproductive rate and did some calculations. If it is that on December 19, we already have Omicron circulating in the communities, but we're not aware of it yet, it could be acting and boiling underneath, and but by mid-January, we could see on a daily basis over 1,500 cases. If it is that we are where we at one static until Christmas Day, and then things start to increase, then we could see almost 600 person per day in January. And if we are at 0.9 now, decreasing a little bit, then we could be just over 500 per day come mid-January. If we did a similar set of scenarios for hospital admissions, we could be admitting, for the same scenarios, 182 patients per day, 122 and 109 respectively, probably a week or two after the 12th, so mid to late January. This means that we could have in beds in January 2,000 persons if the first scenario holds. And if the last scenario holds, then it's 1,200 persons admitted into beds. Just to remind, in the third wave, we had 1,269 persons at our highest in the third wave. So this is the projection for the fourth wave. And so what does this look like if it happens? So the pink line would give you the admissions, and the blue would give you the cases. So the blue diamond shape would be the projected cases, and the pink square would give you the projected admissions. And it would have surpassed by January, mid-January, what we saw in the third wave. So, in wrapping up, the World Health Organization gave an overall assessment, and the overall risk related to the new variant of concern, Omicron, remains very high for a number of reasons. The global risk of COVID remains very high overall, and the current data indicate Omicron has a significant growth advantage over Delta, leading to rapid spread in the community and subsequent increase in hospitalizations. So the World Health Organization on December 17 recommended had some recommendations, many of which we know already. The use of well-fitting masks, physical distancing, ventilation of indoor spaces, crowd avoidance, especially during holiday periods, and hand hygiene to reduce transmission of SARS-CoV, including Omicron. We are to enhance our surveillance with testing and sequencing and have stricter contact tracing, and we are to anticipate our caseloads in our hospitals, which we are doing, and efforts to accelerate the vaccination coverage. This is very important. We all should try and get vaccinated if we haven't done so before. And there's a risk-based approach to international travel measures if necessary. So we are encouraging that all of us use infection prevention and control measures, such as wearing of the well-fitting mask, physical distancing, hand hygiene, washing with hands with soap and water, or using an alcohol-based hand sanitizer. Avoid crowds. All should be vaccinated, especially the elderly and persons with comorbidities. Thank you.
Thank you very much, Dr. Webster-Carr, our Chief Epidemiologist. So we try to give you a more detailed and explanation of the science, and it is the science that guides us. There is a lot of opinions out there, a lot of positions, some under the banner of expert positions, but ultimately we try to focus on what the science says. And the truth is that the science evolves because it is a new virus, relatively new. It is changing with each variant strain, and in many cases, of course, the science has to catch up to understanding what the problems are. So while there may be many opinions out there, we try in health to remain focused on what the science is saying, and we do so in a collaborative manner with our bilateral and multilateral partners and agencies, even while we work internally to contextualize the information that is given. So the conclusion is that we have to be careful. We have to prepare, and we have to recognize the importance of personal responsibility. No matter what we do, there are some undisputable realities that we have to face. Firstly, COVID is here, and it's here to stay. It is not going anywhere. As a result, we have to learn to live with COVID, but not necessarily as we have been living over the past 2 years. It means we have to pivot, we have to adjust, we have to do what is necessary to protect ourselves and those around us, our family, our co-workers, our neighbors. And it means, therefore, that we have to recognize that every single Jamaican has a role to play. And so, for us in health, it is about providing the information in the first instance so that we all understand the role that we each as individuals and collectively have to play, hence the discussion here today. Secondly, it is to prepare based on the assessment that has been done and to provide guidance and advice around those preparations so that Jamaicans act from a position of information. So what is the reality of this particular variant strain? It is highly transmissible and therefore can move from one person to the next very, very quickly and a lot easier than previous strains. It is becoming the dominant strain in a number of countries, and we expect that it is likely to be so in the case of Jamaica. We should not become complacent in terms of the perceived mildness of the strain. Yes, there are experts who have said that the likelihood of hospitalization is less, and I know there is some comfort in that, but complacency could be a false sense of security. And I say so in our context here in Jamaica for the following reasons. We have low vaccination rates, and the more persons who get the virus, the greater the likelihood of hospitalization going up, particularly among the vulnerable, the over 60s or the immunocompromised individuals. We are now just, about 50% or so of the 60s to 80 years in terms of vaccination, high 40s. So there is a full 50% or thereabouts of that age cohort who are not yet vaccinated. It means that if the virus spreads in that population, as we expect it to, even in cases where it may be mild, the more people who get the virus, the more we expect that some will become ill and sufficiently ill to go to the hospital, which is why the projections are as follows, that we could end up with up to 2,000 persons being hospitalized. Well, the data that, the preparation that we are putting in place for hospitalization, up to this point, we have one additional field hospital, Savlamar, to finish hopefully by the end of the year. We will have approximately 1,200 beds to support inpatient care for COVID cases. We do have step-down facilities, so where you don't need hospitalization, you stay in other facilities, including being at home with support. But where hospitalization is needed, we have up to 1,200 beds, and I think it's important to make that clear. We cannot, I'm sure, transition other beds, but it will be at a severe cost to other persons who need critical care, which means ultimately you're going to have to give, and someone will suffer if we were to go beyond that. And so we really have to ensure that the demand is far less than that, but at least no greater than. And that's something that I think we need to make very clear. We are preserving the temporary staff, over 1,300 staff members or employees who have been helping in the field. We have extended their employment to the end of the first quarter of next year. And that is, of course, to ensure that we have the personnel, because one of the bottlenecks would be personnel availability. We are reviewing our PPE requirement so that equipment and other things can be purchased and in stock. We are pushing on vaccines, and this is a special appeal again to Jamaicans to take advantage of the vaccination that is available. We have more than enough vaccines, and our focus will be on the community arrangements, going into communities. We are going to be deploying in short order 4 additional mobile buses that will take the staff into communities, remote parts, population centers. As we speak, I know there is a deployment in a few places in the country, encouraging and making it easy for persons to get vaccinated. That's a personal decision, but it's an important decision in the interest of your own protection. There is a lot of conversations around testing. We did announce that we would make available self-test or home test kits. That procurement process is in train, and we anticipate in another few days, week maybe, we'll be able to get some into the country as a public good. But we are encouraging private entities to import and to make available across different outlets for persons to utilize. We do recognize the margins of error around those tests. The PCR remains the gold standard, but nevertheless, it does provide some form of screening, and the technology is in fact improving over time. And that process is ongoing, and we'll provide further updates on that. I would like to close by again emphasizing, before questions are allowed, to Jamaicans that we have to recognize our own role in this response to COVID. This is a season of good cheer. This is a season of reflection, a season in the Christian calendar of giving thanks and recognizing the many blessings that we have benefited from. It's been a long struggle, 20 plus months of COVID. It's been a difficult one for many people, for those who have lost their loved ones, for those who have been on the front line, for all of us who have had to make sacrifices. This is another phase of the challenge that we have to confront. And we will continue to provide the information and give the support, but we want to encourage Jamaicans to recognize their role. So in the season, as we approach, please take some bold decisions. If you're going to entertain, meaning small gatherings, whether family members or close friends, maybe we need to take a decision of asking persons for their vaccination cards or status and make it a rule that as a householder, we will allow those who are vaccinated. And the advantage of having a vaccinated audience is that you have a far better chance of overcoming contamination from the virus than if you have an audience mixed with the unvaccinated, who, if they pick the virus up, are more likely to be affected and even end up in hospital or even death. And so we need to start insisting on that. We need to recognize the need for the masks, sanitizing, the social distancing. The non-clinical measures will be critical in the coming months as we reduce the impact of this variant strain, which we expect to be here in full force going into the new year. And on the clinical side, vaccines remain the most effective, and we will continue to provide the opportunities for this. I want to thank you for the opportunity. Thank you for allowing us to provide this update. We thought it was necessary, given the recent discovery of the Omicron strain, given the high levels of positive tests, PCR tests, that are now being picked up amongst short-term stays or visitors, whether they are locals or those staying in our hotels. It is an indication that there is a high rate of positivity passing through, and it is inevitable that that pass-through will leave some remnants of the very strain behind here in our population, and that will lead to other things. So we are not here preaching doom and gloom or even proposing in any way, shape, or form that we panic, but we are saying this is the reality that we face, and we must recognize it and respond, starting with personal responsibility. Thank you very much. And Steve, I hand to you now for questions.
Thank you very much, Minister. Just reminding our media colleagues to use the raised hand feature on Zoom to pose their questions to the panel. We're going to begin with Christopher Thomas from The Gleaner.
Yes, good morning, Dr. Tufton, and to your members. I'm hearing a bit of feedback. I have two questions. Can you provide an update on whether healthcare workers would have been responsible for vaccination duties, whether they have been paid, and also the data entry clerks who are awaiting payment from that time? And second question, can you provide an update as to the issue of nurses and doctors being paid, as it would have been reported this morning. There's been an issue with that.
Okay, I'm going to ask the permanent secretary.
And we are investigating each instance of non-payment. Our records show it is around 50 persons that are in this lot that have not been paid. I have been made aware of the fact that the Southeast Regional Health Authority has still not yet published or uploaded its payroll, but I am made to understand that if it has not yet been done already, it will be done in very short order. And so the Southeast region, which is one of the 4 regions, health regions under the Ministry of Health and Wellness portfolio, has not, as I said, uploaded its payroll for December as yet. I'm made to understand this will be done in very, very short order. Thank you very much.
Thank you very much, PS. I'm going to go to Cassius Watson from Jamaica Social.
Hi, good morning, folks. I have 2 questions. One for the chief epidemiologist, Dr. Webster Carr, and the other for the minister. Dr. Webster Carr, judging by what we've seen at infection over the period, we've now gone over a year. Your thoughts on natural immunity? What percentage of the population do you believe has actually experienced or had COVID-19? Because it would seem to be, judging by the numbers and what you had said initially, that it must be more than half of the population that have experienced the virus. What impact do you think that is now having on the reduction that we're seeing in case counts and infection rate right now? And my question to the minister is, you mentioned that 20% or just over 20% of the population is fully vaccinated. What else in a country that is blatantly hesitant to take in vaccine? What else can you as minister or your ministry do or what plans do you have to get more people getting more shots in their arms? Thank you.
Okay, thanks for that question. So it's not a specific science. What we know is that natural immunity, and even when you get immunity through vaccination, it wanes. So how fast it wanes is not really known. We did some modeling, and based on that, it could be less than 10% who would be immune now because of natural immunity. But then you can't then just add this to the vaccination number, because some persons would have been vaccinated as well as they would have had COVID. So that's about how much we think probably have natural immunity, given some waning and so on. So that's as much as I can say on it. Thanks.
Okay, so the question for me is, what else, having done what we have done, vaccine take-up, and still have a relatively low take-up, 20%, 26% single dose. It's an issue that we have spoken about, assessed over and over in our minds and as a team, and certainly at the highest level of government. There have been issues along the journey. I will accept that. And in the early stages and over time, we have had to pivot and adjust, partly because strategies change. There's greater familiarity with the process, training, and so on. So we have moved from central sites to permanent fixed sites to variable sites to community activation to persons who can now call and get vaccinated on demand if they are immobile at the level of the parishes, and to engagement of stakeholders, the church, to the private doctors and the private contractors. And it hasn't been a perfect process, but I do believe we're at a stage now where we have the vaccines and we have provided the means by which persons can be vaccinated, the outlets, both through private or public partnership and initiatives. We will continue on that trajectory to pivot where necessary. Whenever there is a concern, we will listen and we will adjust. I mean, the private doctors, very low take-up, they have some concerns. The need to have a refrigerator, for example. Now, it's something we need to discuss, and if there's a way around that to get more of them to take on the process, we are very open, because our objective is to give full opportunity. There's an issue of choice of vaccines. I think we have settled that because we now have options in terms of brands that is available, and people can get on demand as long as they meet the basic requirements. Ultimately, sir, I can't force anyone to take a vaccine. We can't hold people down and put a needle in their arm. We can, as a society, collectively, and certainly as government, as policymakers, or as leaders at the level of the firm, institute programs around encouraging, motivating, showing the value to personal life and to freedom of movement, to taking the vaccines. And I think we have to continue to do that. I suspect that as time progresses, you will see a further evolution of the policies, where there will be more focus on vaccination or testing, and that will, I believe, be more a common approach across the board. You would have seen some issues in the courts recently and some positions taken by the courts, which I believe is encouraging for the vaccination program. And I know that the government, under the leadership of the Prime Minister, Andrew Holness, has been deliberating on other options with the advice and support of public health. And so in the new year, I believe we will see further adjustments as we go along. These are not decisions that are left up to the Ministry of Health or myself. It would have to be collective at the level of cabinet. I know we are concerned as a government, and we will take whatever action further that is necessary. But the idea of sort of forcing persons to take the vaccines, I mean, I don't know how practical that is. I think persons need to come to terms with the need to take the vaccines, and to the extent that not taking it makes them a greater risk to others, whether in their work environment or otherwise, I think we need to ensure that we recognize and play that up more and support policies around that to give better protection for those who have taken the time to get vaccinated. It's a long-winded response, sir, because there's no simple answer. But the takeaway is that as time progresses, we will try to make it easier, try to continue the public education, and where necessary, adjust policy to give better protection for those who take the time to get vaccinated. Thank you.
Thank you very much, Minister. I'm going to go to Roxroy McLean from the Gleaner.
Good morning. The question is for you, Minister Tufton. Now that we've basically loosened the restrictions and with a fourth wave on the horizon, what are the fears of the health ministry in regards to the same?
Okay, so that almost sounds like a loaded question, but so let me try to give a response that is going to be fulsome and cannot be just singularly a health issue. We act clearly as a collective, the cabinet, the government, and the vaccination program and the response to COVID is more about all of us, not just about the Ministry of Health. Having said that, there are and have been risks associated with the response to COVID. In the early stages, we could, I believe, use non-clinical restrictions as the primary response, perhaps partly because we did not have a clinical response. Vaccines were still in the making. And we needed to slow the virus down, knowing it would come, but preparing for its arrival. As we progressed and things changed, we had to adjust, recognizing the other risks that are involved in restrictions. So you ask about the concerns we have. In the first instance, we have had to pivot to address some concerns that were there and lingering. And I'm speaking more widely now. The issues of work, the issues in public health of mental health, and the restrictions on the populations, the very young, the older populations, and their own mental health status, these restrictions and its impact on chronic illnesses, persons not going to the health centers to get their monthly checkup and their medication, and the impact on their own health. And so the loosening was, I think, necessary to respond to some of those side effects, if you will, risks. However, that too comes with the challenge of complacency, the potential for that to set in, and for persons not to view with the seriousness that is required, the continued management in their own personal behavior towards COVID, whether it is to take the vaccine or to wear the mask or otherwise. So we responded to some challenges that were the case, back to school being a big one also. Now that we have responded, we have to now confront some new challenges specific to your question, and that would be complacency. I think complacency is the enemy of the response. And the fear that I have personally is that we interpret the relaxation of restrictions as a license to be a free-for-all and for persons to engage in activities that exposes them to the virus, to the new strain, without any consideration for the consequences. I've been in this for 20 months. I've seen persons who have either refused to be vaccinated for one reason or another, or to observe the masks wearing and the protocols, and they end up in the hospital and they die. They call you in some cases. I've had persons I know who have had to intervene to try to assist, who were not believers in vaccination, did not believe that they should wear masks, and they ended up with COVID and have since passed, regrettably. So it's a real challenge to get persons to remain focused on what they need to do, because no matter what we do, and we will continue to speak to it, the fact is, if Jamaicans decide that they will not observe, even with the messaging, then it poses a risk to them, and it does pose a risk to us too, as a collective, as a country, and to the health system, because the consequences of complacency is the likely possibility of overwhelming the public health system, putting the doctors and nurses under strain, not having the hospital beds, the oxygen, and all the other things to respond to. So my worst fears would be complacency, and complacency leading to the overwhelming of the public health system, which means that people will die. Thank you.
Thank you very much, Minister. Chantel Spence from JIS is asking, any projections on how the discovery of the Omicron virus may affect back to school for next term?
You know, the decisions around back to school and the schedule are decisions that have to be taken at the highest level of the government, the cabinet. I can articulate the thinking, because that thinking has been articulated by the Honorable Prime Minister and the Minister of Education. And that is, and it's a sentiment of the cabinet, that is that we really need to get our children back into the classroom. And there's a public health concern there too, by the way. So I am fully supportive of that position. I cannot fathom the impact on our children over the last 20 months of staying home, even with the best of efforts to get the online teaching, where a vast number of them would have been unable to because of the lack of equipment or connectivity, and the mental stress and the lack of stimulation for development that they would have had to withstand over that period of time. It is a cruel and inhumane component of the COVID pandemic, and we're going to see the consequences of that for some time. So my own view, and I'm venturing out here on a limb, but this has been articulated, is that whatever happens, we need to move towards getting our children back to school, into the classroom, sorry. And we are now working with the Ministry of Education to put in place the protocols in the schools, because it will have to include protocols around the same thing, sanitizing and physical distancing and so on, to the best that we can do, but also a response that will be efficient in assessing symptoms, testing and treatment, and extracting from the population those who display any signs of contamination or having the virus. And that is going to be a collective effort between parents, guardians, school administrators, teachers, and students, involving a lot of public education, a lot of leadership at all levels. So it's going to be a big challenge that we will have as a country. But I think it's a challenge that is worth every single drop of sweat and effort, because I think we are doing our children a disservice, not because of us, but because of the cruel COVID, by keeping them out of the classroom for this length of time. So I am all for working through and playing our part in public health to get them back in the classroom.
Please remember to subscribe, like, share, and click the notification bell for daily updates.